Hi, this is Dr. Dana Rockey, and thank you for watching. Today I want to do a little bit of an explanation regarding current bleaching techniques, bleaching of teeth that is. I've been a dentist for almost 35 years, and I did my first bleaching cases over 25 years ago, so I've been doing this a long time. But today we have so many more options and so many more manufacturers and different techniques. I kind of want to do a quick run through what is available for the patient coming out of the dental office. First of all, probably the simplest and easiest is a special whitening toothpaste or a special toothpaste from a manufacturer that we sell through the dental office. I know there are countless that you can buy on the stores that advertise whitening, but one in particular that I like is from a company called Ultradent, and it's very smooth and creamy and seems to do a really nice job removing stains and getting some whitening of the teeth. Very simple, minimal cost, easy to use, requires hardly any extra effort because you have to brush your teeth in the first place. So this is obviously the simplest way to achieve any kind of lightening of your teeth. Second of all, just so happens that the same company offers a simple sort of what we call semi-custom tray, where you can open these up and there's a thin semi-custom tray on the inside preloaded with a bleaching material. The peroxide-based materials, as we call them, that's been around since the beginning. And these will fit most arches and capture most of the mid teeth and the front teeth, and you get a specific amount in each box, and with a minimal expense and a little extra effort, you can achieve sort of the next level of result. Simple, easy, minimal cost. The next step is what we call custom trays, and these happen to be mine that I use. And we'll take an impression of your teeth, we'll make a model from that, and then we'll vacuum form a tray to fit over the top of that. So it's custom made, this tray, this plastic tray that's very thin and wiggly, that will hold the bleaching material, actually fits over your teeth. And we can dispense different bleaching concentrations of bleaching materials into the tray. You wear the tray, depending on the concentration, anywhere from 15-20 minutes to overnight, in some cases with very low concentrations of material. So significant extra cost, 2 visits to the dental office, 1 for the impression, 1 for the delivery. But the good thing about that is you've got these for a very long time, and I have quite a few patients that come in for a regular prophylaxis and hygiene visit, and they'll just purchase a tube or 2 of the material to refresh the bleaching color that you've achieved. I find that bleaching regression, in other words darkening, over time is a matter of fact, and so this is a great way to just continually do that and keep these in a safe place at home, continually treat them maybe once a month. We have some patients doing it weekly, we have some doing it monthly, we have some patients that when they come in every 6 months they buy a couple of tubes, do it a little bit then, and then never think about it until 6 months later. So this is like taking it to the next level in cost and effort. And finally, you've heard a lot about the immediate chairside bleaching techniques. Zoom is a very popular one that you'll be hearing a lot of and advertised a great deal. Just so happens I like this Ultradent company. They also make a chairside material that I can use here. The issue is that this material is very strong and very concentrated, so we really can't give it to you to use at home with trays without supervision. We'll have you in the chair here, we'll protect the gums with a very special material, and we'll protect your eyesight. And I use this material, in the technique that I use is applied to the teeth for 20 minutes, I wash it off, then I reapply it for 20 minutes, so it's 2 20-minute cycles, 40-minute total, and then that takes a little over an hour, hour and 10 minutes, something like that. My technique that I use here combines the chairside material with the custom trays, so I prefer to make the patient the custom trays additionally, so that after I use 2 rounds of the chairside material here in the office, I will actually put a very low concentration of material back in a custom tray. They walk out the door, they wear that for another 10 or 15 minutes and get some additional whitening from that. So again, here's the lineup. Very simple and inexpensive are the toothpaste, of which some are dispensed by dentists, others of course can be purchased in any drugstore, CVS, etc. Semi-custom trays, which can be dispensed at any time, worn at any time, very simple and easy, semi-molded by yourself to the teeth, preloaded with bleaching, sort of the next step in a little bit more effort and a little bit more in cost, but still relatively inexpensive. The next step, of course, is the custom trays. That would be 2 visits, an impression visit, and then a delivery visit after they're fabricated. with a multitude of different concentrations that can be used depending on any sensitivity we get in your teeth or any sensitivity that we get in your gums. This is sort of the next level in cost and complexity. And then of course the next step, as I say again, is a chairside-based material, which should not be dispensed by the dentist to be used at home. I don't personally. I use it here because it is fairly highly concentrated, and great care has to be taken that it's not splashed on the gum tissue or in the eyes or something like that. But you do get a significant amount of whitening in the chair. And then my own particular technique, as I say in review, is to additionally make the custom trays, put a very low concentration material, walk out the door. So you can see we have various different options. A lot of this was not available when I first started 25, 30 years ago. But we have a lot of options today. Patients are still asking for it, and we're happy to provide the service because it does look very nice. No reason why you shouldn't have the color of teeth or the degree of bleaching that you really want. So thanks again for listening. Take care.